Dr. Allen, we talked about the risk factors, and so I'm more concerned because I hear more and more about the elderly falling and breaking a hip. And so if you could elaborate on that a little bit.
Sure. The World Health Organization did put together what we call a FRAX tool. This slide shows you here that there are certain risk factors that are put into the calculator, and then it calculates your 10-year probability of a fracture risk of a major osteoporotic fracture, or also just of a hip fracture.
Okay.
And physicians have access to this, and they can, in a postmenopausal woman, do this very simply in the office. And anyone who has a 10-year probability of fracture greater than 20% might consider being on some medication, or a hip fracture greater than 3%. Might consider being on some medication. So it's a very simple thing that can be done and give some idea to the patient about their risk of fracture.
Okay. And what age group are you looking at for this?
We're mainly looking at postmenopausal women, and we really only get information about hip fracture. It can't be really used for the spine.
So where would they go to get more information about the study from
We
the
have
university?
some slides that we'll put up, and it will tell them where they can call.
Okay.
And if they're eligible, they can call in, and we screen them over the phone. And then if they're eligible, we bring them back and have them come in, and they get a physical exam, and they'll get a bone density and some blood work, and then they're randomized to either a relaxation or an exercise program.
Okay.
They're given Shantex, which is a common drug that's used for helping people quit smoking.
Okay, now is that a prescription that you would have to give them as well?
Right.
Okay.
Well, we give them the drug, but yes,
Okay.
you would have to get that by prescription from a physician.
Okay.
And they come in weekly for 8 weeks, and they get counseling, actual program, and then they either do their relaxation session or they do their exercise session. And they're given more Shantex, and then they're still followed for up to 15 months.
Oh, okay.
At less frequent intervals. And we are hoping that they will continue the exercise routine if they've been in the exercise program. And then we're looking at the end of 15 months again at their bone density to see what effect quitting smoking might have on their bone density.
Okay. Now you mentioned relaxation. So is that also part of meditation that they do work with?
Yes, it's not specifically meditation per se, but they do teach them techniques in terms of relaxing and kind of pleasant thoughts, and they do different things in that group to get them to relax.
Okay. And then let's say someone is smoking but doesn't feel the ability that they have the capability of exercising. So do you just maybe walk with them, or what type of exercises? What are your expectations of them when you're talking about exercise? You know, some people really shy away from it because they think you want them to run 5 miles, and you know, you're going to monitor their heart. So
well, we do screen them medically before they come in and make sure that they can do some level of exercise.
Okay.
And then we do stepwise type of exercise. We tailor it to what they are able to do, and we do slowly increase the amount week by week.
Okay.
But we don't push them to the point where they can't do it.
We just want the basic walking, you know, doing a few of the movements, whereas you are increasing your bone, and nothing that you're going to have to do a hard cardio workout.
No,
not boot camp or anything like
that. No. No.
That's good to know. So let's just recap a little bit. You know, we basically talked about what is osteoporosis, and that, of course, concerns about your bones and the density of that. And then the people that are at risk, we kind of followed up with that as well. And then a few other things, if there's anything that you want to elaborate on.
Well, I think the most important thing is just to say that there are things that people can do to improve their bone health. And as I mentioned, the calcium, the vitamin D, the exercise, everybody should do that. People who have osteoporosis, that's really not the treatment for osteoporosis. A lot of there are medicines on the market that physicians can prescribe that can help improve the bone. But for everybody, they should at least be doing the exercise and taking calcium and vitamin D. That's something that people can easily do and is beneficial for them. And quit smoking if they're smokers.
Yeah. No, well, the one thing that I really love about it is that you actually follow them for their progress. And it's not like, you know, you just write them up a prescription to put the patch on and then let them go. You critique and take care of them so that this is a team effort, it sounds like. Very much.
We do relapse prevention as best we can, because that's really what's really important in the long picture, to keep them quit.
Yes, and as hard as it was for me to quit smoking, it was probably the hardest thing that I'd ever done, you know, because of the nicotine actually really kind of grabbed me. And, you know, it was a chemical use and it felt so fantastic when I did quit. And the brain clears up and you don't feel like you have those cobwebs in the morning as well. Okay, well, we have a few minutes left and I'd really like for you to throw out to my viewers about yourself and your team and the University of Minnesota as well.
Okay, well, thank you. I just really would like to close with saying that it's important for your health to quit smoking. It's a treatable disease. It is a disease. And it's a chronic disease, and we are here to help you. We have several studies at the Tobacco Research Center and would welcome you to come into the study to help you quit smoking.
Great. Well, I appreciate this.
Thank you.
We've run out of time, but I appreciate you bringing all this great information to my viewers.
Well, thank you for letting me be here.
I look forward to having you view other shows of Knowledge for Wellness and visit my website at www.knowledgeforwellness.com and let me know where you viewed my show. And you can also connect with me on Facebook, LinkedIn, Twitter, and YouTube. And the mission of Knowledge for Wellness is to inform viewers on health issues, to expose, educate, and make viewers aware, to enhance themselves and their loved ones for a better quality of life. And I hope we have provided you with more knowledge to benefit you and your loved ones. So until next time, be well and goodbye. Thanks, Kim.
Lord, who am I that you would speak to me so softly? Conversation with a love most high. Who am I? Well, amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found, was blind, but now I see. And the more I sing that sweet old song, the more I understand that I do not comprehend this love that's coming from your head.